Hi everyone, welcome to another special short video from Westside Healthy Living Space. I'm your host, Miss Funke Deniji. So today I thought I would talk very briefly about contraception. I was having a conversation with someone the other day, and it's a conversation I've had many times before, both in practice and on a casual basis. And the person was talking and complaining about the fact that they're not going to use contraception because they've seen what it's done to people and how it's made a lot of people put on weight, etc. And it just made me think that, oh, and they told you it was this, and they said, and I was like, that's probably not the full picture. Um, yes, it's true, contraception can cause many things, but it's the fullness of the. I think people just put a blanket thing out there and said contraception is bad and contraception does XYZ. So what I thought I would do today in this video is just talk very briefly about some of the myths and the facts when it comes to contraception that will help you to make more informed choices about contraception. Now, I know that there are some people listening to this video that don't believe in contraception for religious reasons. And I'm not here to convince people either way. But what I would say in the context of religion is that personally, I don't believe contraception is a sin. And the reason I don't believe it is a sin is because I'm not sure in biblical times that it was used. And there are certain things that the Bible doesn't specifically tell us not to do because the Bible is a guide. And there comes a point where you're guiding someone where you have to trust their intuition and their ability to make the right decision. And the right decision when it comes to contraception depends on the context of the situation. What do I mean by that? So, for example, there are some people, say, for example, that have a medical condition. In an ideal world, being a Christian, being a Muslim, being a religious person would mean that you are disease free. You don't have to worry about any form of disease. However, we all know that's not the reality. There are good Christians, good Muslims out there that have diabetes, that have medical conditions, and in some cases, some of those women are a bit young. And because certainly we're seeing a lot more younger people getting diagnosed with long-term conditions, and some of those people might be wanting to try for a baby. And in order to reduce their risk of having a baby that's stillborn, or a baby with medical issues, or even their own health, maternity mortality is a serious thing, and it's not that hard for bad things to happen in pregnancy to people, even those people that consider themselves healthy, talk less of when you have a long-term condition or a medical condition. So in such cases, sometimes we need to do what's called a planned pregnancy, and we need to work really closely with the person and help them to have a healthy baby and maintain their own health and well-being. In those cases, sometimes we may need to use contraception for a specified length of period, just to mitigate against the risk of uh, a difficult pregnancy, is, let me put it. So you always have to think about the context. Now, in that context, I think it's appropriate to use, but I don't know, maybe you're listening and you think differently. I'm more than willing to live. I know that some people say conception, life begins from conception, which is true. So in my mind, it's like, okay, let's prevent you from having life, let's prevent life in the first place, right? So that because contraception works. And this is important because some people say, for people that believe in abortion, sorry, I'm gonna get to the myth, but I feel I also need to say this. People that believe in abortion say, people that don't believe in abortion say it's because you're killing a life. There's a fetus, there's an embryo, it's a living thing. Contraception, I don't believe that you're doing that. And the reason being is because contraception actually stops a life from coming into being. If you know how a lot of contraceptions work, you will know that concept you will know that there isn't a living thing. Contraception stops that from happening. So you're not really destroying a life. And in some cases, you may be protecting and preventing death to the mother, or death to an unborn, an unconceived child. So we need to be really careful in how we interpret these things and we understand things. But like I said, that's a topic for another day. That's not what I plan to talk about today. What I did want to tackle today is some of the myths and the facts when it comes to using contraception. So I have 10 that I'm going to just skim through very briefly. The first one is weight gain. The first one, because I think that's really a very popular myth that, oh, I don't want to use contraception because it makes people gain weight and I don't want to gain weight. So the reason why I say that is the fact of the matter is that contraception as a whole, and it's important you understand when we talk about contraception, there are different forms of contraception. And so there may be one form of contraception or one type of contraception, but that causes weight gain, but not all of them. And that means that you have a choice. You may choose not to go with that one that has the potential to cause you to add weight, and you may choose to go with another. So the fact of the matter when it comes to contraception and weight gain is that yes, the depot injection, which is the injectable form of contraception, can cause you to add weight in the early days. And so if you're someone that's prone to weight gain, you may choose not to use it, or you may choose to be more disciplined in terms of maintaining a healthy weight. So that's the first one. And then the second thing about contraception and it causing weight is that some of them, and I'm thinking the combined hormonal contraception. So the combined one are the ones that contain, are the pills that contain two agents. Most times they're used for 21 days of a typical 28-day cycle. And some people will stop it for 1 week and have what we call a withdrawal bleed. That one, sometimes people can feel that they've put on weight, but they haven't actually put on weight. What's happened is that sometimes that particular type of contraception can actually cause you to retain water. And that water can give you a sense of maybe you've put on weight, but actually you haven't. And a lot of studies have been done about this, and it's actually a fact that not all forms of contraception cause you to put on weight. The depot injection can cause you to add weight. And that's why you need to be really careful about choosing to go along with it. All of these forms have their pros, their cons, and it's why when you're making a decision about contraception, you shouldn't make it in isolation. You should make it in conjunction with a healthcare professional to advise and guide you, because once you take the injectable form of contraception, yes, it's good because you don't have to worry about missing pills and the hassle of taking something every day. But the disadvantage sometimes is that once it's in your body, it's in, you can't take it out. So if you if it makes you put on weight, that's it, you're gonna have to deal with that. But it doesn't happen to everyone, but it can happen. So that's something to be aware of. And then the other thing with weight gain is that for some people, a side effect can be increased appetite. And if it increases your appetite and you're someone that loves food, then yes, there's a possibility you might put on weight. So so that's the facts about it. So it's not a blanket case of all contraception puts on weight. The depot injection, yes, you can put on weight with that. Not so much with the other forms of contraception, although depending on which particular one you choose and depending on your body, I can't mention specific ones because it really is contraception is one of those things that it really is an individual thing, and finding the right one that fits sometimes can mean you having to try one or two to find the best fit for you as a person. The second myth is that it can cause infertility. Again, this is associated more with the injectable form of contraception. There are studies and there is evidence out there that suggests that it doesn't stop you from being fertile, but it can delay a return to fertility. So in these days where a lot of us are having babies older than before, that may be an important consideration. If you're thinking of having a baby soon within the next couple of years, or you are thinking of having another baby, you've had one baby and you're thinking of having another baby and you want to space it it may not be the best choice for you because it can cause a delay in a return to fertility. I think the figure is about a year it can take you to return to fertility, plus or minus. So you might want to think very carefully in that scenario as well. But other forms of contraception are not known to do that. So once you stop, your body should readjust, go back to reset and go back to normal, and you should be able to conceive as you would, before or without contraception. So that's the second one. The third one is that it causes bleeding. Yes, contraception can cause bleeding, and this is often one of the reasons why we have to try different contraceptions for people, because we don't know just how your body is going to react. The bottom line with contraception is that we are kind of trying to control your hormones, etc. But the thing about hormones and women, it's how our bodies react to hormones, and is very unique, and I don't think we've fully figured out how. At the moment, it's still a little bit up in the air because we're so individualized. One person can take it and they get no bleeding issues whatsoever, they're just fine with it. Another person can take it and they have very light bleeding, or what we call spotting. Another person can take it and all of a sudden they have heavy bleeding non-stop. It is very, very individualistic. And so that's not a myth, that is actually a fact. Most forms of contraception can cause some degree of bleeding. When I say most forms, I mean in terms of medicinal forms of contraception. Let me be clear, because if you're someone that is vulnerable to bleeding with medicinal forms of contraception, like your contraceptive pill, injections, patches, implants, etc., then we may need to think more about having a non-medicinal form of contraception. And there are a number of those out there. You've got the condom, you've got the female condom, which isn't spoken about so much, partly because of the practicality of using. So there are other options if you're that kind of person, or even if you're that kind of person that is like, you know what, I don't want to take any medications. There are alternative options. Don't suffer at silence, and don't put yourself at a risk if you're not ready to have a baby. Having a baby is a big deal, so don't put yourself in a situation where you don't have a choice. The whole point of contraception is to empower you, and is to enable you to have a choice, as to when you conceive, how you conceive, and conceiving in a healthy way, and when you're in a good place in your life. So that's the third one. Um, not all forms of contraception cause weight gain. Not all forms cause delay in return to fertility. Not infertility, but a delay in return to fertility. And a lot of medicinal forms of contraception can cause bleeding. Okay, so that's number three. So number four on my list is that it causes clotting. Okay, so the issue with clotting, the risks are not as high as a lot of people seem to think. And yes, there is a slight risk that it can cause clotting. And that risk is increased, depending on your person, depending on your medical history, depending on what other medical conditions you may have. And one of the reasons why it can cause an increase is because a lot of the estrogens, estrogen is one of the components. It's a natural hormone, and it's one of the components we put in some medicinal forms of contraception, in particular the combined hormonal pill, because most other forms of medicinal contraception are based on progesterone. However, with the combined pill, it's based on estrogen and progesterone. So the estrogen component is the bit that we're a bit scared about. And what it is that the synthetic forms of estrogen can be a little bit more, can cause the blood to be a bit more sticky. So which means that there is a risk that there is a higher risk of clotting with them. So there's a higher risk, but it's not significant enough for a healthy woman to be that worried or concerned about it. It is more people that already have a risk of having clots that need to be concerned about using it. And that's why there are certain situations and certain people, like people that are smokers, people that are overweight, etc., that we encourage not to use combined hormonal contraception. So yes, that is a possibility. And just going back to the bleeding, one of the things I didn't mention is that sometimes that can also be used as an advantage, because there are some people that we're able to use that side effect somehow to manage their periods. So people that have really heavy periods, for example, sometimes we can use contraception to control that bleeding. Or people that have bleeding in between periods, we can actually use contraception to help mitigate against that and help to control the cycle a bit better. And I guess if you want to minimize your risk of a clot, um, in all situations, then the idea is if you use it consistently, it's better. When you stop, start, you actually increase your risk of getting a clot. But I want to stress that risk of you actually having a clot is actually quite small. You cannot compare the risk of you having a clot with someone that is overweight, someone that is a smoker. All these things are also high risk factors for clots, and they're actually higher than the contraceptive pill on alone. So let's make sure we're always putting things into context and we're not looking at things in one way. So that's the fourth thing. So infertility, weight gain, bleeding, clot risk. Another myth is that taking contraception prevents sexually transmitted infections. This is a blatant no. Contraception, medicinal contraception, important, does not protect you from sexually transmitted infections. The only form of contraception that we have significant amount of evidence, I think it's like 99% or 99.9%, is the condom. And even the condom, there are certain, like when it comes to using your mouth, etc., you're not always covered with that. So contraception doesn't prevent the risk of sexually transmitted infections. So if you're at high risk, or you're doing things, or you're sleeping about with having unprotected sex and all those kind of things, then you really want to be using the condom. Don't rely on contraception. What medicinal contraception does is stop you from getting pregnant. It doesn't stop you from getting infections. It doesn't interfere with, you having, some people say the condom, which is a myth in itself, stops you from having good sex. And because I guess some men say they can't feel as much, this again is a myth. Nowadays, there's loads of different kinds of condom, some that can even increase your sensation of pleasure compared to others. So that shouldn't be a problem anymore. So if you're someone that, so if that's your situation, and you're scared, maybe you have a partner and you don't totally trust them, but you feel like you're unable to say no to them when it comes to sex, then you really want to consider other forms of contraception. And if you can't say no to unprotected sex, then make sure after having unprotected sex, make sure you get yourself checked. Because if there is a risk of you getting an infection or getting HIV, there are things we can do. If you get yourself checked, at least I would probably say you really want to get yourself checked within 72 hours of actually having unprotected sex. If you do that, then, we can still do things to mitigate against, you getting any sexually transmitted infection. Really important to note that, because medicinal contraception will not protect you from infections. Yeah, so that is a blatant myth and not a fact. Another one is, this is a common one. When I used to do the odd sort of shift in a community pharmacy, this was the number one thing people would come out from. And there's a lot of people that believe that it's okay to use emergency hormonal contraception on a regular basis. They don't want to go on long-term contraception. They don't want to use medicinal forms of contraception. They don't want to use non-medicinal form. They feel like, oh, if I get caught, I'll just use emergency. And there are some people that end up doing that 3, 4, 5 times in a month. And that's not good. Emergency contraception was never designed for you to use it on a regular basis. It's a high dose of a progestogen. So when we're talking about risk of side effects and messing up your natural cycle, then that is a sure way to do it, by taking emergency contraception on a regular basis. You're taking a really high dose of a progestogen. And if you're doing that on a regular basis, then that's not good. You risk, you're going to mess up your natural balance of hormones, which can cause a lot of other problems. And it's just not a good thing. So I would really discourage you from using emergency. It is, as the word suggests, it's the emergency, and it's for emergencies. And if you have to use it twice in 1 month, then you probably need to be thinking about other forms of contraception, whether that be other contraceptive pill, the implant, the injection, condoms, but you really need to be thinking hard about how you protect yourself from getting pregnant and not become reliant on the emergency contraception, on the emergency hormonal contraceptive pill. There is the coil as well that you can think of that can be used. The certainly the copper coil can be used preventively, and it can also be used in emergencies. So that's something that you may want to consider. I don't know if you're going on holiday for a month and you're that kind of person that feels like, you know what, I'm on holiday, so I'm just going to go wild, probably not a lifestyle I would encourage, but I know that there are people that may do that. And, I would discourage you from doing that. And in that situation, you may want to consider the coil if you don't want to consider long term contraception. So I think it's important to remember that there are always options when it comes to contraception. Just make sure you speak to the right person so you can get the right advice. So that's what have we got to? So we've said weight gain. So when you think weight gain, think injection. We've said infertility. I must stress delay in return to fertility, not infertility. It's not going to make you infertile. Number two. Number three, we spoke about was bleeding. Number four, we spoke about was clotting. Number five was preventing sexually transmitted diseases. Number six, emergency contraception is not to be used on a regular basis. Oh, number seven, I'm in my 40s and 50s, so I don't really need contraception anymore. And I'm perimenopausal because that's the word they call it, for example. So my periods are not consistent. So you know what, I really don't feel I need contraception, so I'm not going to use it. That is a false myth. The fact is, so long as you're still having periods, even if your periods are irregular, you can still get pregnant. There are cases of women. That's why up until most contraceptions are licensed, when we talk, or most guidelines, should I say, talk about contraception to the age of 55 for women. And that's because although most fertility clinics will tell you you don't have a chance, what we believe when it comes to contraception is if you're having a period, there is still a chance you can get pregnant naturally. So if you really don't want to take that risk, maybe you've finished your family and you're really worried about getting pregnant again or what have you, then you do want to be thinking, and you're still having irregular periods, then you may want to be thinking about using contraception still. 40s, you can definitely still get pregnant in your 40s. We're having a lot more women these days having babies in their 40s. I think in their 50s, people are still a little bit, iffy about it. But fact of the matter is you can still get pregnant in your 40s and your 50s. So if you're having periods, even if they're irregular, consider using contraception if you don't want a baby. Or if you need to have a planned pregnancy, because that's the other thing. If you're having pregnancy at an older age, generally speaking, the baby is more at risk and you are more at risk of birthing complications to both you and the child. So there may be a case for you using contraception to prevent such things. And if you're actually trying to have a baby as an older woman, then it may be that you use contraception to help plan that process so that you end up on the other side with your health intact and with a healthy baby, if that's you. So that's number 7. So number 8 is it can affect my libido. So yes, I would probably say yes and no to that. I think sometimes if you're on the contraceptive pill or medicinal contraception, it can there are sometimes side effects. Like I said, hormones are very, our hormones are very, we can't predict what side effects anybody is going to get. And so there may be some cases where people actually, their libido is affected by hormonal contraception. But on the flip side, there are some people that find that because they're less anxious, they have that security that they're taking something, that they're not going to get pregnant without wanting to get pregnant. They have that inner peace, and that reduces anxiety, and anxiety can be a hindrance to your libido. So because they're less anxious, actually there's a sense of their libido has increased, and maybe it's more because they feel freer. So sometimes, so it can kind of go either way depending on the situation. So that's kind of a yes and no, I guess, is the answer for that one. So that's number eight. Number nine, yes, breastfeeding. So some people feel like breastfeeding is a form of contraception themselves. So I just need to stress there are three things that need to be in place for breastfeeding to for you not to get pregnant when breastfeeding. So number one, you must be doing exclusive breastfeeding. So just breastfeeding. You must be at least you must have been doing it for at least 6 months and you've not had a period, because not having a period means that you haven't ovulated, and if you haven't ovulated then you can't get pregnant. So those three things need to be in place for breastfeeding to be a reliable form of contraception, and for you to say I don't want to have get pregnant and decide not to take hormonal contraception and have unprotected sex, then it must be a case of you haven't had a period for 6 months, you're breastfeeding exclusively, and you're not ovulating. So those conditions must be met for breastfeeding to, for you to rely on breastfeeding. So that's what have we got to. So we've spoken about weight and injection, weight and fertility, bleeding, clotting, um, emergency hormonal contraception, your 40s, your 50s, clots. And then libido is number nine, and breastfeeding is number 10. So that's the 10 myths, common myths around using contraception. So I hope you enjoyed the video. Sorry I went on a bit longer. This was meant to be a 10-minute video and it's about a 25-minute video. So I apologize if it's taking a long time, but I hope that you find it useful. And if you have any questions or you need personal advice, then just visit the Healthy Living Space at www.westscionline.com, and you will see you can easily book an appointment at one of our clinics where we can give you further advice about a medication, supplement, or your general health and well-being, or anything that I've discussed in this video. Bye bye for now. Till next time. Bye.